Okay, this video is a catheter change. We're not going to go for the open tip one, which I was going to go for an open tip one, which has got, I think it's 0.5% glycerine in it, but this one, we're still going to use the ruche. It needs to come out because he's having tummy issues. He's actually got low blood pressure at the moment, so he's not breathing right, so I'm going to be quite quick with this.
Yeah, you know why? Because it is affecting that
And
area.
I can definitely smell something. And the other thing, right, I've only got a resistance of 4 mils.
What?
Which means I'm going to have to go and get some pads quickly and padding, because I do believe from this...
The urine.
The 95 is sat. Just stay still for me. His heart rate's fine. So there's the resistance, and that's all I'm getting out.
That's correct.
Do you want the other catheter in? I mean, I have put your new catheter, but I haven't got the glycerine catheter ready.
No.
So all I've got out there is 4 mils. So you want to go for this catheter?
Well, what do you think?
Well, you need to tell me quickly because your blood pressure's really low. So it's running at 87 at the moment.
I just want to get this done.
What do you want me to do?
Because it is affecting my chest.
I know it's affecting your breathing. This is why I need to eliminate it as quickly as. So you need to tell me what would you like.
Just change the catheter.
Okay. So what I'm going to do is I've got all my sterilised stuff here. I've got sterilised gloves. I've got everything ready. All the catheters ready already. I just needed to have that quick reading. So I'm going to use a piece of gauze here. I'm going to pull back his leg. And I'm going to release this catheter, which is, yeah, it's quite brown. How does that feel? So that is what we've got. We've even got hair on it, actually, which is like very unusual. You all right? You sure?
Yes.
I'm going to see if I can get any urine out of
Is
there.
urine coming out? No.
Are you okay? Because your sats have gone really low.
No, stop pressing my fucking stomach.
Okay. How do you feel?
Fucking like shit.
Okay, I might have to stop this video in a second because I'm going to have to rush about.
Fuck.
How do you feel?
Like shit as soon as you press the stomach.
Okay, so what I'm going to do is I'm going to be as quick as I can. Let me just use that. So I'm going to use the inside because now I'm in an emergency with them. I've got to get this inside in. So this is in Stilla Joe.
Don't press the stomach again.
Okay. I need to just open up. So this is an emergency.
Yeah, it was.
So his sats went down to 88, which is not normal.
No, it weren't.
Where's that I'm trying to get?
Have you got it?
No, because you've got kind of like... there we go. Oh, great.
Got it?
Yeah. Don't worry. Just you keep breathing nicely for me.
I am breathing.
So why I'm doing this is because there's a feces. There's a certain smell. His tummy is distended. His breathing has become laboured, which we've just known that on video. And before I put that new catheter in, so I'm going to relieve that a minute. I'm just going to leave that there. So I'll keep the stoma open.
Did you put the new one in?
Not yet. I'm just going to do another reading first.
No, don't do another reading.
I've got no choice, Ben. I've got to give you a reading, mate.
Oh, okay.
I need a reading because your blood pressure's really low, mate.
Well, it would be. My stomach. It's my damn stomach, Mum.
I know it's your stomach.
What if I've got air up there?
So what I'll do from this, if the catheter doesn't work, if it fails, which I don't think it will, if it fails, then I'll go up the other side of that, the back side, and I'll release the air pressure from the inside of his bottom.
Air up there.
I don't think he's got it.
What?
I'll just wait first. Wait. It's very low. It's coming in a lot. It's gone back up to 111 over 62, so that's a good bit. That's a good sign, not a bad sign.
God, thank God.
So whatever anybody does, carers do in the future. So I'll pull that out now, which is the syringe for the instiller gel. And all this is sterilised here for the catheter. And I've already got it on the bag. I can only touch it with this one hand. So
Probably didn't last that long.
it didn't, but I think I do need to put the glycerine one in.
Well, you
So
will then.
with the glycerine one, the tip of the glycerine is much, much better. It's got a
Wait,
hole
wait.
at the top and not a hole there, look, straight through the middle bit. So are you ready?
Yeah,
Are you
I'm
ready for this?
I'm ready, love.
Right, so we're going to mess about a little bit, give it a little wiggle. It's going to be a bit difficult because he's on his side and he's doing some spasms at the same time.
Mm-hmm.
Come on, you little bugger. Oh, this, breathe for me. Are you okay?
Yeah.
If you can do some breathing, that'd be great. Seems to be blocked off a little bit. There we go. There we go. I've got urine straight away. I've just got to move that hand. So I'll hold it there for a couple of seconds. Ask him how he is. How do you feel?
Still, it's my stomach still. I believe.
I'm going to take that hand off. I've got a bag here.
At least you got it in.
It is in. I do believe we should put the other one in. 93. Just going to wait for some urine. I'm going to try and clamp that to there. I'm going to clamp it here to his... actually, I'll clamp it with the bag here. Are you all right?
Yeah, I'm fine.
How's your breathing?
It's still my stomach though.
Where's my syringe gone? Because we've just had an emergency. That was an emergency, a full
It was,
emergency.
as soon
to be
as you
fair.
pressed the stomach.
Yeah, it was an emergency. So I don't mind touching all this stuff now because I'm looking for the syringe, which don't seem to be here.
Didn't you do
I
one?
must have thrown it away.
Oh no. You threw it.
I must have thrown it away. I'll use this. That's all right. So what I'll do is I'll just cap off. I've got a sterilised tray right next to me here. I'm looking at his sats and I do have a syringe here. I've got to hold that catheter in at all times.
Of course you have.
So normally you've got a pre-filled one. I don't know what the hell's happened to it, to be fair. And like I said, when you're in an emergency, you haven't got no messing about. You haven't got time for messing about like that.
No, you won't.
Not when they desat. Somebody desats. So I'm just popping I'm going to pop 10 point... Actually, I'm going to pop 11 mils in that balloon. Actually, no, I'll put 10.5 will do. See if it helps. Are you feeling okay?
Feeling AD.
You feeling AD?
Yeah, arsehole wise.
Bottom wise, you mean?
Yeah.
Not this way.
Not that way.
So yeah, I'd say this is kind of a difficult catheter. This is messing me about now. Excuse me. So this is me messing about with the catheter.
Have I farted?
I don't know. I just want to get the balloon done up, so I'm doing it as quickly as I can. So I'm pushing the 10 mils in, which is just saline. I've got a beautiful hot flow, which is great, which is what you need. He's going to have to go on antibiotics.
I don't mind.
And no blood, so that's a good sign. And I do have a bit of a flow. I haven't got much yet, but if I massage his stomach,
Don't push it too hard.
I'm not going to massage. I'm not
For
going
God's sake,
so I'm not going to do that.
please.
I'm not going to do that because you've got tummy problems. I'm not going to do that.
I have.
It's really weird because I've just been in the garden again, just to do a bit, get out
I've been all
into
right
the
all
fresh
day
air.
today.
And Ben's been fine all day today, which is really bizarre.
Friday
there's my
night.
syringe there. You always find it afterwards. But I did have it all together, so I don't understand that. It was all there. It was all fine.
Yes, it was.
I have a hot tube. But I think what I might do is just massage the tummy.
Yeah, do it slow.
Just nice and slow
Slow.
for him, because if I
If you
don't...
press it, God.
He's got 97% saturations, which means the oxygen's going around his body, which
did
is
feel better,
fine,
to be
because it
fair.
went into the 80s, which was
You know that.
EE.
I
You
did
feel better?
Yeah.
I'm going to check the blood pressure again, just to make sure that the BP is absolutely spot on. This was an emergency. This was...
You know, Andres,
Yes.
you know, he said to me once, you know, if you ever get hair in the catheter.
Was that so?
In the catheter,
Yeah.
in the bladder itself,
Yeah.
it would cause a major problem.
So there was a hair actually on top of the actual catheter. I don't really want. I can't show you because it's not.
No, because you've already been
It's in
getting
the bag. I'm not going to go in that bag because I don't want to dirty anything. I'm just making sure we've got a flow. I mean, I've got not much flow at the moment. Obviously, I'm waiting for it to move. It's gone to 123 over 77. These are sterilised
that
wipes.
fine
Don't matter
now,
if it
then?
goes there. Da-da-da.
How's the stomach?
Your stomach's fine. You've got a bit of red blotches on your tummy. That smell's gone. So I don't know what that smell is all the time, but I think you need to go and have it checked out. Maybe one whenever you can.
No, I think it's the catheter's older. I believe so.
See, let me show you this catheter that I did want to put in today, but obviously because it's an emergency, I'm not going to mess about with putting a different catheter in when it's in an emergency, really, just for Ben, because he's got breathing issues as well. And I'll show you which one we're putting in. And these are new for him, new for Ben. So it's an open tip. So these are open tip ones. So what I mean by open tip is at the top of the catheter. I'll show Ben because he hasn't seen it. So there's the catheter itself. And right at the very top there, it's all open. So it doesn't go down here. And how it blows up is exactly the same. But you blow it up. Many consultants don't like what you use because you have to use different solution. And I'm going to end up arguing with people. I've been told that by the nurses myself. Once I've put this inside Ben, this one, we're going to end up with arguments because of what I'm going to be using, which is the glycerine is okay, but obviously it's not. It's still like Instilla gel what I'll be using, and it's only 6 mils. Yes, this blows up with only 6 mils. It doesn't blow up with
10.
With 10 mils, which
How
is
does
what
it
we
stay in there?
That's how it stays in.
That's
So it
nice.
stays in place, but obviously the other solution is what I'm going to end up arguing with because it's 6 mils of that, and it's a bit of a nightmare. But that is an open tip one, and that is what I will put in the next emergency if Ben does have one, which
I have
I
still
hope he
got a
does.
stomach problem, though, I think.
But he does have a stomach problem, and we still haven't really got much urine out, so I need to go right round the back here to make sure he's got nothing in his kidneys, and it's making sure that it doesn't backflow, especially how he just desatted then.
Well,
That was desatting, so he desatted saturations, the oxygen, down onto the 80s, which is not good. And he also, I'm not looking at the camera, I'm looking at the machine, and he also did low blood pressure, which was 94 over 70 something, which is kind of really pretty bad. So you have to act pretty quick, and if I don't do that, then I would have to call an ambulance because there's only so much I can do.
Obviously.
And then what I'm going to do now is I'm going to go up the other end, which I'm not going to show on camera. And hopefully that we don't have to give a bladder wash on this, but we'll see. I'll clear up this mess and then we'll go down for the next bit. And that's how you do it. And as you go along, all you do is keep sterilising your hands and sterilising your equipment, sterilising the bag when you're finished with it, because obviously He's desatting again now. You're right.
Yeah.
So Ben suffers with a really, it was rare with a diaphragm issue. So his gut, his bowels and everything was in his chest when he was a baby. So that is why we have that issue. And he's also got scoliosis. So I have all the medical experience to deal with so much, but I can't deal with it all. But his stomach looks like it's gone down. It's still gassy in my opinion.
It is gassy.
And I've given him gripe water.
She's given loads of things.
I have, yeah.
To try and relieve it. It's not happening.
And I think he's going to end up in hospital because there's nothing else I can do. Anyway, that's the video on another catheter change. This time it was a real major emergency change, which is a bloody nightmare.
Oh, God.
Especially after the dog just passing away. It's like, see, we actually thought with the dog passing away, it was the dog's problem, you know.
Well, you did.
I know. So, yeah, that is the issue there. And we've only got a bit of urine come out there, which is like a bit of a pain in the backside. And now we're waiting for this, look. So 95 is okay, but normally then about 97, 98. So it's going up a bit. We'll just wait for this and hopefully hope for the best and he'll be all right.
I do feel better in bed.
Feel better. And gripe water, honestly, if anybody has problems with gases or anything, just take a couple of spoonfuls of gripe water for an adult. See, they're low again. They're very low. So I'm going to have to sort him out and get this, go up and do something else now.
You're going to have to.
Yeah.
I just don't know what it is.